Hello and welcome to our special show where we have all your questions on coronavirus, vaccines and variants answered by one of India's top doctors, Dr Randeep Guleria, Director of AIIMS, who joins us on this show every week to answer all your queries. Thank you so much, Doctor, for joining us today. Now, it's been a very, very challenging week. We've been hit by the second wave of COVID. It's worse than the first one. And the last few days, India has been reporting over 1 lakh daily cases. There have been challenges on the vaccine front as well, with several states complaining about shortages. So lots of issues to discuss. But first and foremost, Doctor, we want to start with news you can use. And we have a lot of questions that our viewers, keep sending us regarding the vaccines, their doubts, their concerns. So we want to start with asking you all these, 5-6 questions regarding that. Now, the first and foremost, can you get COVID after getting the vaccine, and what should you do?
So yes, you can get COVID after getting the vaccine. It's important to understand, how does the vaccine protect you? The vaccine protects you from getting severe disease. That is, you will, even if you get COVID, it will be a mild form of COVID. You will not land up in the ICU or have or the chance of dying because of COVID become much less. But you can still get the infection. You may get the infection on your nose and throat. The virus may replicate there for some time, and you may be able to spread the infection to others, but the antibodies in your blood will then not allow the virus to replicate, and they will not allow the disease to become more severe. So yes, you can become positive even after the vaccine, and you can have mild symptoms, or you may be asymptomatic, and you can spread the disease to others.
Now, another question we get very often from viewers is, which vaccine is better? We only have 2 vaccines in our kitty so far, but which of them is better?
So if you look at the current data, there is really nothing to say that one is better than the other. Both have almost equivalent efficacy, and the safety profile of both is also good. So I would say that whatever vaccine you're able to get right now, you should go and take that rather than trying to pick and choose, because I think both are equally good, and we should just try and get as many people who are in the priority list to get themselves vaccinated as early as possible.
All right, Doctor, there are a lot of concerns after the news that's coming from Europe, and the news concerning clotting in connection with the AstraZeneca vaccine. Even the UK has spoken about it and admitted there's a link, and they've, recalibrated their advice. So a lot of concern over here, even though so far, we haven't really given any advice. But for people who have got the AstraZeneca vaccine, which is the Covishield vaccine over here, regarding clotting, is there anything they can do? What do they need to look out for?
So this is a rare side effect which is now being reported. It was first thought that this could be coincidental, but now there are studies which suggest that this may have a link with the vaccine, although it's very, very rare, and very few cases have been reported, considering that almost millions of people or crores of people have been vaccinated. It has not been seen that much in our country, although there are some suggestions that we may have a case or two. What classically happens is that almost about 10 to 15 days after the vaccine, people have symptoms of fatigue, body aches, and a general feeling of tiredness, and then the platelets tend to come down, and along with that they have a chance of increased clotting. There is clotting in the veins in the brain or in the abdomen. The intestinal veins can also get clotted, and this is very akin to another immune disease which is known as heparin-induced thrombocytopenia. So yes, it's an autoimmune disease, very clear, similar to this. It's being rarely seen, and now there is a feeling that although it's very rare, one needs to look out for that, and if that happens, then you have a treatment strategy in place in terms of giving what we call IVIG and other treatment strategies.
So what do the people have to do? Suppose, there are people who've already received the Covishield vaccine, and, now they're concerned about this news. What will they feel? Is there anything they need to look out for, any sort of symptom, and then they know that they have to contact their doctor?
So if you had the vaccine and after 24 hours you're all right and you have no symptoms, and it's been, let's say, 3 weeks since you got your last shot of the vaccine, you need not worry. It doesn't happen after that. It usually happens within the first 14 days or 10 to 14 days after the vaccine that this side effect happens. It's not that it happens 5 months or 3 months after the vaccine shot. So you need not worry later on if the vaccine duration has been more than that. In the early part, you must, if you have any symptoms and you're concerned, you must contact your doctor immediately and get the relevant tests done.
And what are the symptoms again, if you could just, clarify that?
So classically in the blood reports, your platelets tend to come down. It causes what we call thrombocytopenia. Generally, what it leads is body aches, fatigue, fever, and then there is clotting. So if there is clotting in the brain, there may be drowsiness. Some patients have had pain in the stomach because of clotting in one of the vessels in the intestine, and that can lead to what we call abdominal pain or breathlessness. But it's very, very rare. So if you really look at the number of cases that have been reported as compared to the number of people who've had the vaccine, it seems to be a very rare complication, but we need to look out for it, because then there is a specific treatment strategy which needs to be followed.
Absolutely, and that's the point. I think all of you doctors and experts have been emphasizing this is very rare. There have been like a handful of cases, there have been deaths as well, but compare that to the millions who have been vaccinated very, very safely, and the overall protection that the whole society has got from coronavirus. Another additional question regarding this as well is that some countries in Europe have limited Covishield, that's AstraZeneca, there to certain age groups. If you could explain that to us.
So again, this is something that they're looking at, because this was reported relatively when they looked at this small group. Remember, this complication is something like 1 in a million or even less than that. But when they looked at this small group of people who had this complication, it was relatively in the younger age group as compared to the older age group. And that's why in the younger age group, less than 60 years old, they're still trying to get more data. And that's why it's been sort of, that criteria has been put by certain countries.
All right. And in India, do we know, are we going to have any sort of advice around this?
So in India, it's not been really reported that much. It seems to be much lesser in our ethnic population, but we need more data. And the committee which looks after the adverse effects following immunization is closely monitoring for any such side effects which may be there with the vaccine. They are having regular meetings and looking at both serious side effects and mortality. So we will have some idea in the coming few days if there is a chance that this may be also being seen in our country.
All right, and the requisite advice will be given, and caution, etc. Continuing with our news you can use, and we get a lot of questions from people that, if I have a pacemaker, should I get the vaccine? If I have hypertension, should I get the vaccine? If have a stent, should we get the vaccine? So we want to flip that question and ask you, doctor, is there any situation when you should not get the vaccine?
So I would say that there's really hardly any situation where you should not get the vaccine. As a matter of fact, the criteria that you just mentioned are those who should definitely get the vaccine, because they are the ones who have comorbidities, are in the high risk of having severe COVID. Initially, we had said that there are 2 criteria which are really not approved for vaccination, and one was the younger age group, because there was no data, although now studies are being done and we're very hopeful that we will have clearance for giving the vaccine in the younger age group. And the second group was pregnant women. Now there is also data which is emerging that pregnant women who get COVID may have a more sort of a worse outcome, and a lot of societies, the American societies and a lot of international obstetric societies have started recommending the vaccine even for pregnant women. So that criteria which we were saying is not there as far as the regulators are concerned are being pushed by various associations, because they say again the risk versus the benefit. If you look at it, the benefit of vaccinating pregnant women is far more than the risk that may be there because of the vaccine which has not been tried. The vaccine that we use in India, one of the vaccines, Covaxin, uses a platform which is similar to the vaccine that we give for flu shots. And flu shots are now regularly given for pregnant women because it prevents them from getting serious infection, and it protects not only the mother but the fetus also, and also gives some protection to the newborn baby.
All right, doctor, also now, with this shortage of vaccine that we're seeing in certain parts, and currently right now, a lot of people are having their second dose of the vaccine delayed because of this. It may, it may be all right in a day or 2, or maybe it'll take even longer than a few days. So if the second dose of the vaccine gets delayed, does it compromise protection against COVID?
No, it does not. As a matter of fact, the second dose has a range. For Covaxin, it is 4 to 6 weeks. And for Covishield, it's 6 to 8 weeks. So it's not that it has to be taken exactly on the 28th day or exactly on this day. There is a range, and therefore you can even delay it by a few days. It can happen because you're not able to reach the vaccination site, you're traveling, or for other reasons. It does not really affect the immunity that the vaccine gives to you.
All right, now that brings us to the question of the shortage. So why are we facing a shortage of vaccines? One would have expected, given that we had planned to, inoculate at least 30 crore people by the summer, that weren't orders placed accordingly way back, in November, December last year by the group that you're a part of, the National Expert Group on Vaccine Administration?
So I think this is an issue of looking at distribution rather than the supply part. Vaccines are available. It's just that when you look at vaccines, it depends how are you trying to distribute them. The simplest way to distribute them is looking at areas where you have the population density of people over 45 and proportionally giving it to that area. But it's likely that in some area you may have what we call vaccine eagerness, and in another area you may have vaccine hesitancy. So it's possible that you may have areas where there is a certain surge in demand for people asking to get vaccinated, which is over what one had sort of estimated looking at the trends. And there may be other areas where you may have more vaccines available, but the number of people wanting to come out to get themselves vaccinated will be less. So I think it's an issue of trying to balance out the distribution in various areas depending upon the demand. And I'm sure that will sort of get done in the next few days. And therefore, I don't see this shortage being there for a long time. It should get adjusted. And in certain states, because of the surge of cases, there's been a sudden increase in people wanting to get themselves vaccinated. If you remember, in the early days, there were very few people coming to get themselves vaccinated. So it's a good sign, but I think we need to adjust our vaccine distribution.
All right. The next question is regarding the vaccines that we have, and currently we have a Covishield and Covaxin. So when will we get more vaccines in our kitty?
So this is something that one needs to work on, and I think we are very hopeful that in the next few days we should get the Sputnik vaccine, probably by the end of this month. The company has already applied for emergency use authorization. The data is being looked at, and that vaccine should also be available in the market. There is also the Johnson vaccine, which is now going in for a bridging study in India, and once that is done, that should also be available, and that is a single dose vaccine. Cadila Healthcare is also now looking at getting its vaccine out into the market, and that will also add to our kitty in terms of the vaccine doses. I also feel that we can look at two other things. One is ask other companies which make vaccines to have an understanding with the two main companies which are making vaccines and start producing their vaccines in their plants so that the production numbers goes up. At the same time, start talking to international players, and if they have vaccines which they can give to our country, one can even see whether emergency use authorization can be given to other bigger players like Pfizer or the other companies which are, if they have vaccines to give to our country.
Right. In fact, that was going to be my next question regarding, we urgently need more vaccines, and some experts have even suggested that we do away with the bridging trials, given that we're facing this pandemic right now, especially for proven vaccines like Pfizer, like Moderna. They've already been used extensively across the globe, and we already have all that data, all that information. So can't that just be studied and do away with the bridging trials, which for our viewers, if you could explain, it's something that's also delaying the authorization of the vaccines?
So this is a decision which the regulatory authorities have to take. Sometimes bridging studies are done in a small sample just to make sure that there is no ethnic variation. You see, every population, every ethnic group behaves in a slightly different manner. For example, clotting. Clotting may be seen more in a particular ethnic group and may not be seen that commonly, let's say, in Asians or people of other origin. So you may have some side effects which may be more in a particular ethnic group. And just to make sure that the safety and efficacy is the same, a very small number of people are vaccinated and the data is collated just to quickly get that reassurance that there is no ethnic difference in terms of side effects. Because once you roll it out, you will be giving it to millions. And then you don't want any side effect that you missed out on emerging at that point in time.
All right, Dr. Guleria, do stay on with us. We're going to slip into a very short break and return with a lot more questions that we have for you. Stay with us. Welcome back to our special show. We're in conversation with Dr. Randeep Guleria, who's answering all your questions around coronavirus, vaccines and variants. And the next question for you, Dr. Guleria, is, are the current vaccines that we have effective against variants?
So as of now, the current vaccines are effective against the variants. We have three main variants which we have been identified: the UK variant, the Brazilian variant, and the South African variant. There is also a double mutant which has been identified. Now, what it seems is, especially as far as the UK variant is concerned, that this is definitely more infectious and to some extent is driving this sudden surge in the number of cases that we are seeing, because this spreads very rapidly, unlike the older variant. And therefore, if you have a room with 20 people and one is positive and all of them are sitting together and having a meal, initially out 4 or 5 or maybe 7 would get infected. But with this new variant, all 20 can get infected because it is very infectious and spreads very quickly. So it's a highly contagious virus which we are now dealing with, and that is why the spike that you're seeing is very sharp. There is we need to be very vigilant, because currently the data suggests that the vaccine efficacy may come down to some extent, but they may still be effective as far as severe disease or mortality is concerned. However, having said that, I think there is a need for scientists to really start working on sequencing the variants as they emerge, not only internationally, but even in our country, and start doing various research to see, are the variants that will emerge or are emerging going to really decrease the efficacy of the vaccine, and do we need to tweak the subsequent vaccines to really cover for the variants?
Right, absolutely. In fact, there's already some, some suggestions that at least for the South Africa variant, the AstraZeneca vaccine, that's Covishield, is not as effective, and that's concerning for us if it is very prevalent here, which we don't know. So then that brings me to the next question: is, are we playing down the role of variants? Because yes, you have been talking about it, doctor, but from the government's end, they've kind of played it down, and initially they said that these variants are not behind this surge of cases that we're seeing.
So I think we need to be very careful about that. Variants of concern are something that we need to look at, because one of the ways that, or one of the reasons for the spread of COVID and this fast rise could be because of variants which are more infectious. Although currently they seem to be causing less severe disease, but they are definitely more infectious and spreading more rapidly, which is apparent by the number of cases that we see in various parts of the country. As far as the AstraZeneca vaccine and the South African variant is concerned, there is a paper which suggests that the vaccine efficacy comes down significantly to only around 10 to 20% if you look at the South African variant. But that is a very small study, and the number of events or the number of people who got infected were very small. Therefore, to really come out with that conclusion is something that we need to look at carefully. But yes, there is a cause of concern, and therefore we need to really look at variants very, very critically, both in terms of vaccine efficacy, chances of reinfection, and whether they cause more virulent disease or whether they are spreading the virus more rapidly, and therefore really forcing more and more people to really have COVID appropriate behavior.
Absolutely. We need all that information there rather than playing it down. Coming around to, with this second wave of coronavirus, and now all states and cities are announcing, various restrictions. Night curfew is there in the national capital. And the question many people are asking is, how do night curfews help?
So I don't think night curfews are going to be the 100% solution. They may help to some extent, because it will decrease crowding, especially in the evening. For example, if someone is having a party or late night activities. But the paradoxical thing would be that if you allow people to mix in the morning and have a lunch party and say ban a dinner party, it still has the same effect, because you're still allowing people to crowd and get together and spread the disease. Therefore, I think we have to have a more holistic and response, because unless people start really aggressively following COVID appropriate behavior and take the responsibility of making sure that crowds are not formed, they're always wearing masks, and they make sure others are wearing a mask and physical distancing is being maintained, we will have no option but to go in for stricter measures, because otherwise the cases will not come down. And if the cases don't come down, it will have a significant effect on the healthcare system. Even as the number of cases increase, the proportional number of people who will require hospital care will also increase. The proportional number of patients who will require ICU care will also increase. And that means we will need that many more hospital beds, ICU beds, if we want to save lives. And therefore, that is not going to be something that we can have as an infinite number. Therefore, unless we decrease the number of cases, we will have a huge strain on the healthcare system, which is already quite badly stretched, and this is going to create a huge problem. And that is why I think preventing the spread of disease is very, very important if you want to decrease the strain on the hospitals and healthcare system.
Right, Doctor, and you said that's your message to the public, and I'll say that's the message to everyone, including the public and our netas. I'm assuming the same message of maintaining COVID-appropriate behavior and protocols. That's all the time we have on the show today. Thanks so much, Dr. Guleria, for joining us and answering all our questions. Thanks for watching. Goodbye.
Thank you. Thank you.